Hello, my name is Emma Meyer, and thank you for watching my video about ADHD, also known as Attention Deficit Hyperactivity Disorder. This is a professional development presentation, and I just want to also take a note here at the bottom to make sure that I mention that everything in this presentation is research-based. It is not of my opinion, and it's not something that would be hearsay or anything that's not research-based. So what is ADHD, also known as Attention Deficit Hyperactivity Disorder? ADHD is a disorder that is neurodevelopmental, and it's characterized by inattention, hyperactivity, and impulsivity. So it affects kids in how they can limit their attention, how they might be able to focus on one thing at a time, or their ability to to be impulsive. So students might not have the ability to pay very, very close attention to one thing. They might be aware of only one thing at a time, which would categorize them to hyperfixate on something, but they may not have the ability to focus on the one thing that you're asking that student to focus on. Some behavior interventions that you can implement in the classroom, as well as at home if you're a parent of a child with ADHD. So first I have listed positive reinforcement. This would be categorized as praise, rewards for correct behavior. So anytime that you're able to tell a child with ADHD that they're doing the right thing, just reinforces that correct behavior. Consistent consequences, so clear, predictable responses to the misbehavior. Planned ignoring. This is for minor attention-seeking behavior, so this wouldn't be for something that would be a major behavior or something that would be unsafe for the child, but for something that would be minor, just an attention-seeking behavior. Clear instructions and expectations. So having very clear instructions and expectations, even visual reminders within the classroom, is very helpful for children with ADHD, and it just helps prevent the behavior from getting worse, and it helps kids know what to expect from you. Parent education. So I wrote up here, it says ties into what was said about above on behavior interventions. I wrote that right here because I wanted to make it clear that behavior interventions can also be used at home. So to look back at that slide if that is helpful for parents as well. Another thing that's very helpful for parents is to recognize is to identify triggers at home. This is really helpful for teachers, but it's also helpful for parents to know too, like anytime there's a trigger, just to identify it and make it known that that is something that's going to be triggering for a child. Another helpful tip is to break tasks into smaller steps. So not giving a child a multi-step problem without telling them the steps that are in between. Just making sure that it's very clear what the smaller steps are in order to achieve a big goal, for example. Use visual supports and reminders. So I mentioned that above in the behavior interventions slide as well, but visual supports are very helpful for children with ADHD to just look back and reference. And then I also wrote prepare children for transitions. For example, giving them a 5-minute warning before it's time to transition to the next task or the next maybe project or play area or place that you want them to be. Just giving them that a little bit heads up helps with the transition. Medication for students with ADHD is something that is very research based. Um, strong evidence for There's strong evidence for symptom reduction for certain medications with students with ADHD. Stimulant medications are the most effective and they're the best studied treatment. Um, they improve attention and impulse control as well as hyperactivity in students. There are also non-stimulant medications. These medications are to be used typically after stimulant medications, or the stimulant medications they may not be effective, or a student may be allergic to them, something along that line. But there are non-stimulant medications available if that's something that parents choose to use or doctors recommend using. Medication is powerful for symptom control, but best outcomes often involve combining it with behavior strategies. I wanted to star that and put that in here because medication is something that doctors and psychologists typically, they will not prescribe medication below 6 years old. So first, it's important that we combine behavioral strategies as first before we jump to any medication. So, and then along with that, age does matter. A child that is below 6 years old will not be prescribed medication. Academic interventions. An important tip for students with ADHD is to break assignments into smaller, manageable chunks. I talked about that in some earlier slides, but anytime you're giving a child a project, it's important to break it into smaller chunks for steps that they can reference and look back upon. Provide explicit step-by-step instruction that goes with breaking assignments into smaller, manageable chunks. Use guided practice before independent work, so make sure that we're guiding our students through the steps first before just handing them a full task and letting them do it on their own. Check for understanding frequently, so make sure that we're always checking back to make sure that they're understanding what the task is. Students with ADHD often struggle with working memory and sustained attention, so reducing cognitive load improves performance. I wanted to list some environmental supports that may be helpful within the classroom as well as at home. So this would be for in the classroom, but seat students near the teacher or away from high traffic or noisy areas, and surround the student with focused peers. So these are a lot of little tips all in one bullet point, but um, a, just a few recommendations would be to sit the student near the teacher or away from an area that might be a lot of traffic, a lot of people going in and out. So it might be windows, it might be doors, just anywhere that provides a lot of distraction, just sitting the student away from that. Surround the students with focused peers. This would be peers that are not easily distracted, or peers that don't mind someone sitting next to them that might be distracted a lot. Next, I have reduce wall clutter. So this would just be making sure that their environment is calm. So an environment that does not have a lot of, a lot of colors everywhere, or a lot of bulletin boards with a lot of flashy things. That can be really distracting for students. Allow, when appropriate, noise reducing headphones, or when necessary. Organized storage systems, so just making sure that everything that they have available to them is organized. So this might be, for example, labeling some storage bins that they have their materials in, maybe their folders, making sure that their materials are consistently placed where they're able to find them, so they're not taking up a ton of time trying to find everything that they need. Another tip would be color coding their materials, so making sure that everything in every subject is a certain color, just so that they can get to it quicker and reduce the time that it may take to get everything that they need for their learning throughout the day. Another tip is timers and countdown visuals, just to help keep them on track, or a consistent daily schedule, just to keep them on task and help them stay focused throughout the day. Families of children with ADHD. For this slide, I just wanted to highlight some things that maybe as teachers we don't often think about for parents. So I think as teachers, a lot of times we forget that our kids go home at the end of the day and they have separate lives at home. So families with children of ADHD may experience higher levels of stress than a typical parent or typical family. There may be frequent parent-child conflict, just greater risk for that, greater daily frustration around routines. This is consistent if it's consistent at school, it's probably consistent at home too. ADHD is heritable, so some parents may also have ADHD traits, which can complicate, or it just complicates the consistency and organization at home. So just to be aware of that. I wrote coercive cycle, so this is just an example of what one task or one thing leads to the next, and it's a continuous cycle that may happen at home. So if a child resists, the parent will escalate, the child then escalates, and the parent just gives in. This is just an example of what may happen at home to give you an idea of what their behavior is like at school, and it's just a continuous cycle of bad behavior, and it's not ever being handled or prevented or stopped, but just to be aware that is probably it might be happening at home, especially if we're seeing a lot of escalated behaviors at school. Thank you for watching my presentation. If you have any questions, please leave them below.